when you're doing the go for palpation, when you do palpation, patient will tell, doctor, I'm having pain here. Maybe grade 2 tenderness. Okay. Then your sensory examination will be normal. Then coming to your motor examination, first motor examination, check the tone of the muscle by doing the passive movement, that is your flexion and extension. Usually the tone will be normal. Then active and passive movements, ask the patient to do flexion, extension, radial deviation, ulnar deviation, radial deviation, ulnar deviation. So when you are doing these movements, the patient will have pain. Ulnar deviation, the patient will have pain. Okay? Yes. Because the patient is having some swelling on the lateral side. So radial deviation, no pain will be there, but ulnar deviation, the patient will have pain on the lateral side. Okay, then document about the range of motion, that is our radial deviation, ulnar deviation, flexion, extension, write it and compare to the other side. Always compare to the other side. Clear?
Yes.
Then you have to go for the special test. See, coming to the special test, okay, there are so many conditions which will mimic the wrist. See, now the patient problem on the lateral side. Okay. Now I want to do passive, which deviation? Ulnar deviation. Patient will tell pain on the radial. So ulnar deviation increases pain on the radial side. That is a problem in the radial collateral ligament sprain. For radial collateral ligament sprain, we will do ulnar deviation. For example, if the patient is having ulnar collateral ligament sprain, we will do radial deviation. Opposite. For radial collateral ligament, we will do ulnar deviation. For ulnar collateral ligament, we will do radial deviation. Okay? Now, there is one more condition which will affect the wrist is your carpal tunnel syndrome. Your carpal tunnel syndrome, try to remember, patient will tell pain on the anterior side, but not medial side or lateral side. Carpal tunnel syndrome, you know your carpal tunnel will be here. Patient will pain on the anterior side of the wrist, but he won't tell medial side pain or lateral side pain. So carpal tunnel, what the special test you will do, one is your phalanx test. Can you do the phalanx test? That is active wrist flexion for 30 seconds to 1 minute. After some time, what the patient will tell, he will have the numbness, pain and tingling sensation on the first 1, 2, 3 and half of this finger. Pain will be there, numbness will be there and tingling sensation will be there. 1, 2, 3 and half. 3 and half fingers. Okay? And what are the tendons are there which will pass into the carpal tunnel? Tendon. What tendons will pass? Flexor, carpi. No, flexor. I told you, flexor digitorum profundus, 2 4 fingers. Then flexor digitorum superficialis, 4 fingers. Which tendon will come to thumb? Flexor pollicis longus. So 3 tendons will go inside this carpal tunnel. Flexor digitorum superficialis to 4 fingers, flexor digitorum profundus to 4 fingers, and to the thumb flexor pollicis longus. What is the nerve will go? Median nerve. What is the ligament will go? Transverse carpal ligament. So these are the structures which will go inside the wrist joint. Okay. So this is the carpal tunnel means when you do other test is a Tinel sign. That is, if you tap in the wrist, that is what I am doing here is I am increasing the pressure on the median nerve. When I tap on the wrist, the patient will tell pain or numbness in the 3 and half fingers. That is carpal tunnel syndrome. Tinel sign. Just tap here. Pain or numbness will be there in the 3 and half fingers. Okay. So medial pain means if the radial collateral ligament sprain, medial side means ulnar collateral ligament sprain, or anterior side means carpal tunnel syndrome. So there is one more condition is there, dequerens tenosynovitis. As I told you last time, dequerens tenosynovitis means patient will tell thumb pain at the radial styloid process. Usually patient will tell, doctor, when I fell down, I am having some thumb pain. Not wrist, no finger, no wrist, nothing. only the pain will be there in the thumb region. That is our two tendons will be affected here. That is our abductor pollicis longus and extensor pollicis brevis.
Special test.
The special test I will tell you. These are the two tendons which will come to the thumb. Okay?
Pain.
Abductor pollicis longus and extensor pollicis brevis. Like this. See, when you are falling, what you will do? You will place the hand like this. So that is, it is going for abduction and extension. Okay? So the special test is called as Finkelstein's test. Finkelstein's test. How it is thumb will be inside, make a fist, do ulnar deviation. Pain will be here.
Special test.
Finkelstein's test. Okay? Thumb inside, close with the fingers and do ulnar deviation. Usually the pain will in the thumb region, problem in the two tendons, that is your abductor pollicis longus and the extensor pollicis brevis. So there are four conditions. One is your radial collateral ligament sprain, ulnar collateral ligament sprain, carpal tunnel, or the tendons, so that is your dequerens tenosynovitis or arthritis. These are arthritis, usually we will find it with an X-ray. So these are the conditions which will mimic the wrist joint. Clear? So depending upon the special test, depending upon the pain location, we will tell what is the patient problem. Then after completing this, we will go for the special test completed, provisional diagnosis completed. So the diagnosis is radial collateral ligament sprain. So what is the treatment? Main treatment to decrease pain and swelling. So what we will do, we will give some hot packs or cold packs, ultrasound, or we can use some wrist bandage or wrist support to decrease the pain and to provide support, or we can do some taping techniques. Long-term management to improve the strength and the range of motion, we will ask the patient to do some wrist rotation to improve the strength of the muscle, wrist flexion exercises, extension exercises, okay, then abduction, adduction. So we'll give all the strengthening and the stretching exercises in the long term to improve the strength and to decrease the flexible. So to decrease the tightness and to improve the flexibility. Okay, you understand now 4 conditions will mimic here. Radial collateral ligament sprain, ulnar collateral ligament sprain, carpal tunnel syndrome and dequerens tenosynovitis. See, teno means tendon, syno means synovium which is covering the tendon, itis means inflammation. So teno synovitis means these tendons will go for inflammation. That is your abductor pollicis longus, extensor pollicis brevis. Clear? So this completes your wrist condition, your ankle sprains and your cervical spondylosis. Clear? So next week prepare for the exam. These 3 conditions and your assessment.
Finish the
Submit, yes, finish.